Yeah.
Hey guys, welcome back to my channel. Today I'm going to be talking about my top 3 tips for new grad nurses and for a new travel nurse to be successful in their first assignment or their first year as a nurse. These tips are the same because in order to do well in your first travel assignment, you really do need to go back to the fundamentals of being a new grad nurse, things that we forget as experienced nurses because we get into the groove of things, we get used to doing things a certain way. But when you go to a different hospital or a different facility or a different state, things are done completely differently, and you need to learn all over again how they want it to be done at this facility. There's nothing more annoying than a travel nurse that comes in and says, well, at the hospital that I worked at before, they don't care. You're at this hospital now, so you need to do it their way. So these tips and tricks are pretty much the same for a new grad nurse and for a new traveler. First tip that I would give is arrive early. It is so important to arrive early. When you arrive early, I'm not saying like you start at 7 and you arrive at 6:55. I mean, as a new grad nurse, you start at 7, please get there by 6:30 or the latest 6:45 so you can get started on your day. It is so important. I cannot even stress how important it is for you to get there early and get your mind mentally ready for the day. Go to the charge nurse and you get your patient assignment. She'll tell you who your patients are going to be for the day. And you need to, at that time, go to a computer or go to the chart and open it up and look at the patient's history, look at why they're here, look at their meds, and start organizing your day. So this means that if you have 3 patients and you see that one just got out of surgery, one has been here for rehab, and one is here for, abdominal pain or something, you need to organize your day as in who is receiving meds first in the day, who needs to be assessed first in the day, who can hold off until 8:30 to be assessed, and it kind of helps you mentally prepare your day. It helps you mentally organize your day. You want to also make sure to write down all the meds that you're going to be giving to your patients and the times in which they're going to be given. And you want to look up the dosages and make sure that there's safe dose ranges for the patient, especially if you're in pediatrics. Lots of pediatric meds are dosed by weight. And if it's not within the weight range that you look up, then you need to make sure to bring it to your doctor and your pharmacist's attention and have that medication order changed before you give it to your patient, because that will be a medication error. So arriving early is so important because you get to organize your day, look up all your meds, know these meds in your head, because at some point in the day, someone's going to ask you, hey, is John Doe still on Ativan? What dose is he on? And you need to know this. And if you don't know it, it kind of makes it seem like, oh, does she really know her stuff? And you want to be the nurse that knows your stuff. Tip number 2 for new grad nurses and for new travel nurses is pay close attention during rounds. I'm sure travel nurses and experienced nurses already do this because we know how important rounds are. Rounds are when the entire team, all the doctors, the pharmacist, the nurse, the social worker, whoever is working on this patient's case, will all come together in the patient's room and talk about a plan for the patient. So first we'll go over the history of what the patient's doing at the hospital, what happened, why they ended up here, what their labs have been looking like, what meds they have been on previously, and now what the plan is that we're going to do for them. It's so important to pay attention during rounds because you learn so much about your patient that you don't get in your morning report. So if you are missing bits and pieces about this patient and you weren't quite sure why they're on this medication, why are they seeing PT, OT, something like that, it will be clarified during rounds. Rounds is the perfect time to ask questions and to learn a lot more about your patient so that if anyone is to come to you as their nurse with questions, you know the answers to all these things. And when you give report later in the day, you have the answers to all the questions that an oncoming nurse may ask you during shift report. The last tip that I think is so important is stay out of the nursing drama, especially as a new grad nurse. You do not want to be involved in whatever drama was going on before you started there. You don't want to be involved in who doesn't like this manager, who doesn't like this charge nurse, and the reason being is because you're new. You're still on probation. And if you start getting involved in these things, you're going to be associated with these things. And you don't want to be associated with any of the nursing drama. This also applies for a new travel nurse. You're only there for 3 months, 6 months, maybe a year max, but you definitely want a good recommendation from your charge nurses and from the leadership on your unit. So you need to make sure that you are setting a good example, you're presenting yourself properly, and you're not engaging in any of the unit drama. If people start bringing drama to you, just go ahead, listen, nod, don't give your opinion, don't be part of it, and just stay out of it. Watch it from afar. It can actually be a little entertaining from afar, but don't get involved in it. That is my final tip. A better nurse. And I know other people have different tips that may have helped them, but these are the top 3 things that I think have helped me become more of a successful nurse. So thank you for watching, guys. I really appreciate all the love. I appreciate all the comments. Everybody is so friendly. I know that I'm kind of saying this prematurely because there's a lot of drama on YouTube sometimes, but everybody's been really friendly and everybody's been really nice, and I really appreciate it. And I just love you guys so much, and I appreciate all the love. And as you can see, I'm in new surroundings. I actually moved in the last week. Life of a travel nurse. I went from a part of San Francisco that was a little more secluded to like one of the busiest areas of San Francisco. So I'm sorry if there's a lot of traffic noise in this video. I really cannot help it. I'm living on one of like the busiest streets in San Francisco, and I mean, there's nothing I can do. But I can try for the next video to find a better place in my apartment to film, but this is all I got for now. Anyways, please don't forget to like, subscribe, and follow me on Instagram. See you guys next time.